Hi, I'm Dr. Fredrick Echols, Health Commissioner for the City of St. Louis. Before I start, I want to observe a moment of silence for individuals who have lost their life due to COVID-19 and systemic racism. As we continue to navigate through the pandemic, please do all you can to protect yourself, your family, and community. Today we will focus on the impact of COVID-19 on men's health. When referencing men, I mean anyone who identifies as male. The physical, mental, and social well-being of men are critical to our community. Unfortunately, studies show men pay less attention to their health than women, and men often allow their health to be less of a priority to other matters in their lives. Stress is one of the health conditions, and this week our questions and answers focus on men's stress. Damon from zip code 63111 asks, what is stress and how can men recognize if they are experiencing stress? The National Institute of Mental Health defines stress as the physical or mental response to an external cause. Stress typically goes away once the situation is resolved. Stress can be positive or negative and can cause excess worry, uneasiness, tension, headaches or body pain, high blood pressure, and loss of sleep. Everyone experiences stress, but sometimes stress can reach levels that are overwhelming. Some levels of stress interfere with daily life, causing a person to avoid doing things, and sometimes some levels of stress reach a point where stress always seems to be present. This is when unhealthy levels of stress require proper management to achieve healthy lifestyles and improve our quality of life. Some common reactions to stressful events include disbelief, feelings of fear, shock, anger, sadness, worry, numbness or frustration, changes in appetite, energy, desires, and interests, difficulty sleeping or nightmares, concentrating, or making decisions, physical reactions such as headaches, body pains, stomach problems, and skin rashes, worsening of chronic health problems, worsening of mental health conditions, and increased use of tobacco, alcohol, and other substances. Fisher from zip code 63120 asks, how has COVID-19 impacted men's stress? COVID-19 has created fear, anger, sadness, worry, frustration, and uncertainty, resulting in unhealthy levels of stress. COVID-19 has presented numerous challenges that have caused some negative emotions. Job loss, mitigation strategies including vaccinations, physical distancing, quarantine, isolation, and wearing of face coverings, lack of access to mental and behavioral health services have increased levels of stress and anxiety for some individuals. In particular, the mitigation strategies have given individuals a feeling of separation from others. During the pandemic, it is important for our health for us to make dedicated efforts to take care of our bodies, connect with others, avoid too much exposure to the news, and seek help from professional counselors when we feel overloaded and overwhelmed. William from zip code 63112 asks, what male health conditions are negatively affected by stress? According to the American Institute of Stress, there are several male health conditions that are negatively affected by stress, including, number 1, prostate cancer. A 2013 study found that stress on the nerves increases the risk of prostate cancer and promotes tumor growth and spread. Number 2, erectile dysfunction. Stress can also cause erectile dysfunction in men of any age. Personal, professional, and relationship stress is the leading cause of erectile dysfunction in middle-aged men. Stress affects the brain signals to the penis that increases blood flow for an erection. Chronic stress also impairs testosterone production, which can cause impotence. Number 3, infertility. Chronic stress also impacts testosterone levels, sperm production, and sperm quality, increasing a male's risk for infertility. Number 4, cardiovascular disease. Stress has been shown to increase the risk of heart disease. Stress increases blood pressure and cholesterol, which are major risk factors in the development of heart disease. Repeated episodes of stress also can cause inflammation in your coronary arteries, increasing the risk for a heart attack. Number 5, chronic pain. Stress has been linked to increased pain sensitivity. It can cause your muscles to tense, which can lead to ongoing pain in your neck, shoulders, and back. Stress is also a common headache and migraine trigger. And number 6, frequent colds and infections. Chronic stress affects your immune system and interferes with your inflammatory response, making you more susceptible to colds and other common infections. Samuel from zip code 6310 asks, do you have any tips for how men can deal with stress? If found early enough, many unhealthy conditions men experience are treatable and some are even preventable. Stress can develop into an unhealthy condition that can be managed. The City of St. Louis Department of Health advises men who begin feeling the onset of stress to consider using the following stress management tips. Take breaks from the news. Taking breaks from watching, reading, or listening to news stories, including those on social media. It is good to be informed, but hearing about a traumatic event constantly can be upsetting. Consider limiting news to just a couple of times a day and disconnecting from phone, TV, and computer screens for a while. Take care of yourselves. Eat healthy, exercise, get plenty of sleep, and give yourself a break if you feel stressed out. Take care of your body. Take deep breaths, stretch, or meditate. Try to eat healthy, well-balanced meals. Exercise regularly. Get plenty of sleep. Avoid excessive alcohol, tobacco, and substance use. Continue with routine preventative measures such as recommended by your healthcare provider, including vaccinations and screenings. Get vaccinated against COVID-19 as soon as possible. Get a booster shot when you become eligible. Make time to unwind. Try to do some other activities you enjoy. Talk to others. Talk with people you trust about your concerns and how you're feeling. Share your problems and how you're feeling and coping with a parent, friend, counselor, doctor, or pastor. Connect with your community or faith-based organizations. Avoid use of drugs and alcohol. These may seem to help, but they can create additional problems and increase the stress you're already feeling. Recognize when you need more help. If problems continue or you are thinking about suicide, please talk to a psychologist, social worker, or professional counselor. Remember, everyone experiences stress, and asking for help is not a sign of weakness, but a sign of strength and responsibility. If you or someone you know is considering suicide, please call the National Suicide Prevention Lifeline at 1-800-273-8255. Again, the number is 1-800-273-8255. The Lifeline provides 24/7 free and confidential support for people in distress, prevention and crisis resources for you and your loved ones. For more mental and behavioral health resources in the St. Louis area, please visit www.namistl.org/crisis-info/. Thank you for tuning in, and thank you to Damon, Fisher, William, and Samuel for submitting questions this week. Be sure to tune in next week for more critical public health information. I really want to hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well, St. Louis.